Yes, Dr. Shaista, you can start.
Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Dr. Shaista, graduated from JSSDC Mysore. I was into private practice for almost a decade after my graduation and then gradually weaned off practice to be a full-time homemaker. Besides the fact that I'm not working as a dentist, I take honor in being a student of GDP, a platform that is open to teaching, learning, and interacting. Every day there's a new lesson I learn from the stalwarts on this forum. The zeal with which the doctors come up with case discussions and presentations is really impressive. Today I'm invited to host a webinar on a very less discussed topic or not so discussed topic called sexual harassment in healthcare industry and workplace. Dr. Noor, can I have you presenting the slides, please?
Absolutely. Can everybody see the slides?
Yes, we can see it.
Alhamdulillah.
Violence against women is experienced by women of all ages, social classes, all races, religions, and nationalities all over the world. It is overwhelmingly perpetrated by men. It is the most pervasive violation of human rights in the world today. Its forms are both subtle and blatant, and its impact on development profound. But it is so deeply embedded in cultures around the world that it is almost invisible. The fear of violence, including harassment, is a permanent constraint on the mobility of women and limits their access to resources and basic activities. Most crime against women go unreported for understandable reasons: attached social stigma, drawbacks in legal mechanism, fear of retaliation, and so on. Sexual harassment is a form of sexual violence, though it's not primarily about sex, it's about power and abuse of power. It is important to know that males in medicine and dentistry also experience abuse and harassment and discrimination. However, females experience it more than males. The next slide, please. Yeah. The question is, why are we discussing this topic as dentists? For the simple reason that opposite genders interact at the dental colleges, clinics, and offices as bosses and subordinates, as professors and students and interns, not to miss the fact, the proximity we have with our patients as dentists. We have to have open discussions about this topic. We need to bring out facts and figures, find solutions, need to get to know how and to whom to report to, just in case we or anyone whom we know is subjected to workplace harassment. Now, this slide shows workplace harassment of a nurse in her own words. In one instance, she was harassed inside the OT in front of her co-workers with the webcam on. So you can imagine the audacity of the perpetrator here. Now, when she approached the organization, they failed to protect her, and all she could achieve by this ordeal was a flimsy apology from her perpetrator, who was a renowned anesthesiologist. Slide 3, please. She is Dr. Tahira Ayub. She is a Pakistani oral and maxillofacial surgeon who stands tall in a male-dominated field. She attributes it to the fact that a sound and supportive environment at workplace and at social and family system is what helps her tide through, when most of her female counterparts have quit because of gender bias, discrimination, and harassment. The next slide, please. Okay. Dentistry for the longest time was a profession dominated by men, but over the last 40 years, proportion of women is increasing steadily, raising the question about effect of feminization in this profession. Many instances of harassment at dental schools have come to light, undergrads being most vulnerable and PGs at the hands of examiners and superiors, more among the hostilites than the day scholars. In a study conducted with 300 Oregon dentists and 300 dental hygienists, 44% of providers experienced one or more patient verbal advances, and up to 23% of providers experienced one or more patient physical advances during a 5-year period. Now, these advances were a significant source of concern for many dental professionals. Given the paucity of research on issues associated with sexual harassment in academic settings, and especially in dental schools, more studies are needed to assess the frequency, type, and etiology of sexual harassment involving patients and students or professors and students in the academic dental environment. This slide shows the inference from one such study conducted at Aracatuba Dental School, Sao Paulo State University, Brazil. Now, the next slide. Okay, we have certain laws for discrimination on grounds of pregnancy and disability. Nothing much to say about this. The only thing is, in India, I don't know how much these laws apply and how far we can go ahead with these things. Basically, no one is supposed to discriminate against a pregnant woman, give her the same load of work that she used to do when she was not pregnant. Same holds good with the disabled professionals as well. The next slide, Dr. Noor. Okay. Dentistry is a profession where the idea of one's personal space and intimate zone is completely ignored and abused. There is an unstated agreement between patient and dental practitioners that the laws of proxemics will be violated. This is not on purpose most of the times. The procedures we conduct, the chair position, the placement of instruments are all relative to each patient. This is a double-edged sword wherein the treatment is required, but the proximity could be abused by the doctor to the patient or vice versa. Now, what are the consequences the victims experience? Can I have the next slide, please? Yeah, thank you. Negative consequences of harassment can be long-lasting and severe. Those who experience sexual harassment in any work environment can suffer chronic health problems, post-traumatic stress disorder, depression, anxiety, employment difficulties, and relationship problems. The next slide, please. Lack of awareness and shortage of information regarding the legal procedure and implications related to sexual harassment should be dealt with. We should try to create awareness and find solutions, and should try and refer the victims to relevant interprofessional team. One such institution is Brainwave, and our speaker for today, Dr. Noor Fathima, heads it. Without further ado, let me take the pleasure of introducing Dr. Noor Fathima to all of you. Dr. Noor Fathima comes with 21 years of experience working across diverse geographies and industries. Her research work at the doctorate level has been accredited by Indian Institute of Management, Lucknow, and Indian Institute of Technology, Kharagpur. She works very closely with the corporate and academic sectors nationally and internationally, and has carved a niche for herself in the area of behavioral therapy and counseling, and as a neurobehavioral scientist and thought leader. The resume is very, very long and very, very impressive, mashallah. The list goes on and on about all her credentials. Alhamdulillah, she has touched many lives through her coaching, counseling, interventions, and initiatives. The best part about her is she perfectly blends the high and noble Islamic values with her academic knowledge. May Allah protect her and preserve her. Ameen. Dr. Noor, the forum is all yours.
Jazakallah khairan kathiran for that very, very humbling and warm introduction, Dr. Shaista. I'm just going to stop the slide share. Give me a moment and share my slides with you all before we get started.
Thank you for helping me out with the slide share.
You're most welcome anytime. Are my slides visible to everybody?
Yes, ma'am.
Alhamdulillah. Before we get started, let's first of all seek the blessings of Allah subhanahu wa ta'ala and ask Allah to put a lot of khair and barakah in today's session, in this presentation. It is the blessed days of Dhul Hijjah. May Allah accept our siyam, our piyam, our qiyam. May He erase our sins and elevate our status and accept all our sacrifices. Ameen, Allahumma ameen. With that, let's start off with today's session. This is a topic that is the need of the year. It is indeed a crisis that we are facing, and it's deteriorating. It's going from bad to worse. Harassment at the workplace is a very sensitive issue and should be dealt with the utmost care, patience, and understanding. Inshallah, in today's session, I will do my best to present a holistic picture of what's happening around us and how we can deal with it. So, what we are going to cover in today's session would be, we'll try and understand what harassment is all about and understand the various types and forms of harassment. Let's look at the incidence of harassment in the healthcare industry, not just in the healthcare industry, let's look at it across industries as well. But I will give extra emphasis to the healthcare industry. Let's focus on strategies, tips, techniques, and ways in which we can combat it. Where can you go to when you need help? What is the protocol that organizations have to follow? What are the government laws and what is the government mandate? What are Islamic and secular ways of dealing with this social evil? And finally, I will wrap up the session, inshallah, by looking at alternative career options that might be available for healthcare professionals. So with that, let's try and understand what harassment is all about. And I would request the participants to ask questions, to be as interactive as possible. When I ask you a question, feel free to type out the answer in the chat box or unmute yourself and answer the questions. So are we all okay with that? Can we make it a very participative and engaging session? Just give me a thumbs up if okay.
Sure, inshallah.
Inshallah.
Inshallah. Alhamdulillah. Alhamdulillah. So starting off, let me ask you a very, very simple question. What is harassment? In your understanding, what is harassment?
Any kind of a discomfort which your employer or colleagues put you through. It can be verbal, it can be physical.
Excellent, excellent, fantastic. Thank you, Nausheen. Very nice. Anybody else? What is your understanding of harassment? I think we've all experienced some form of harassment in some way or the other. It might not be to a very large extent, but at least subtle nuances of harassment, I'm sure we've all undergone. Yes, no?
Yes. Asking for unnecessary favors.
Very good. Yes, absolutely right.
Making lewd remarks.
Correct. Very nice. And that's exactly what harassment is all about. According to the definition of harassment, it refers to statements, derogatory comments, slurs, lewd remarks, propositions, assault, impending or blocking somebody's movement, offensively touching somebody, entering their personal space, a physical interference with normal work or movement, any form of visual insults. It could be cartoons, it could be showing pictures, of yourself in scanty clothes. It could be memes, it could be posters, it could be anything. All this is referred to as harassment. And this is not acceptable. So if we have faced any of these things, then we know we are being harassed and we have a right to voice, to raise a voice against it. And that is what we should be doing. Now, let me ask you a very, very simple question. Now, we understand what harassment is, but harassment comes in various forms. And through the definition itself, it's very, very clear. So can anyone very quickly tell me what are the various types and forms that harassment takes? And if you can give examples, that would be fantastic.
It can be verbal.
Yeah.
Very good.
Psychologically demoralizing.
Excellent. What else?
Could be sexual, it could be financial, it could be emotional.
Brilliant. Bang on.
Physical.
Yes, absolutely right. In fact, the most prevalent form of harassment we would see is harassment that is sexual in nature. And sexual harassment again falls into three categories. You have visual sexual harassment, you have sexual verbal harassment, and you have sexually physical harassment, physically sexual harassment. So let's look at each of these and let's look at a few examples. When I say verbal harassment, it means subtly, inappropriately inviting somebody for lunch or dinner, just through your words, making a remark that you might be sexually interested in that person, or an inappropriate remark, knowing that the other person may be committed to somebody else, is already in a relationship, is already married. And even if they are not, if the person is not interested in you, we cannot make these kind of statements. It's extremely disrespectful. Making remarks or insulting somebody, making lewd comments, are all considered various forms of verbal harassment. In fact, labeling and nicknaming, I mean, I have seen this so common in all organizations, including the healthcare industry, where you call somebody, oh, she's a hot chick. How often have we heard things like that? Hot chick. That's a very sexually offensive statement, and it might hurt the sentiments of the other person. It's just not done. Or when you say things like, oh my God, big butt Belinda, just because she has a big butt or a big bosom, not done. These are very, very insulting remarks and statements. Calling nicknames is the worst form of verbal abuse that we can, and it's the most common form also that we come across. Physical sexual harassment is very, very common. When somebody, and we know this very easily, somebody comes and inappropriately touches you, or you're walking and they just bump into you, intentionally bumping into you, not the accidental bumping. And, they actually derive pleasure from rubbing themselves against you, or coming into your personal space and talking too closely very close next to you, or if you're working on a computer, almost literally breathing down your neck while you're showing them an email, or you're discussing a case with them, they come very close and sit very close to you. All these are forms of physical sexual harassment. Anything that interferes with the physical movement of a person and prevents them from completing a task at hand, it has been defined as physical sexual harassment. And the third component is the visual part of it. Can you give me examples of visual harassment? And this is very common and increasing in today's age.
They look at us very inappropriately.
Yes, leching. We call that leching in a very layman's language. Absolutely right. You stare at a person's butt, or you stare at their chest, you stare at their bosom, or you even just staring continuously at their face. It's very disgusting, and it's you feel so irksome. And it's happening not just with women, it's even happening with men these days, especially in the IT sector. You have things like becoming the boss's blue-eyed boy. So they have to do favors for their bosses, and this is not done. And there are women who check out men, just like how men check out women. Women today are also losing their moral character. And in Islam, we call this haya. The haya is completely being lost. There is no regard for somebody else's body. The dignity is completely being robbed away, in today. And it is because of the media. It's because of the exposure that we have. It's primarily because of the entertainment industry. And what is even more scary is today we're talking about harassment at the workplace. Even our children are exposed to it, which is even more scary. But that's a completely different topic, which I'm not going to address in today's session. My focus is going to be primarily on workplace harassment, but visual harassment is on the rise. At the workplace, there are people who would send you WhatsApp messages on WhatsApp, on Instagram, on Facebook, their own pictures in which they want to show their machoism, they want to show they want to show how handsome they are, how beautiful they are. Cartoons that we might see, memes meant as silly jokes, but actually have a very powerful sexual connotation to them. All these are examples of sexual harassment, and this is not acceptable at all. This is all with sexual harassment. Now, we also have something called emotional and mental harassment or mental abuse, and this is less visible. Sexual harassment in its various forms, whether verbal, physical, or visual, is very expressive and very explicit and upfront in nature. Mental trauma is not that visible, but its impact is far more devastating because it cripples the confidence of a person. It cripples their self-esteem. In fact, studies have shown that consistent or constant emotional and mental abuse leads to severe anxiety, depression, panic attacks, trauma. All these are very, very common. In fact, in severe cases, it leads to psychosomatic disorders. What are psychosomatic disorders? Does anyone have any idea? Any guesses?
Physical ailments related to mental health issues.
Very good. In fact, you might have a proper physical disability or a proper physical ailment, but it has no medical diagnosis for it. So it could be something like a recurring headache or a migraine, but it is not because of any physiological disorder. It is because of mental stress. It is because of trauma. It is because of anxiety. You can get severe stomach upset, and the doctor would not be able and says, no, your stomach is perfectly fine. You can go to a gastroenterologist and he says, no, physically, there's nothing wrong. And then immediately he starts asking you, is everything all right at home? Are you happy with your work? And understand that this kind of stomach problem is a psychosomatic disorder, palpitations, chronic pain, high BP, even high blood pressure. In most of the cases, high BP is because of stress and trauma. And in harassment cases, it's even more drastic. Heart-related issues, thyroid, diabetes, all this could be because of anxiety, stress, harassment, and trauma. So a mental abuse has a far more devastating impact on an individual. It cripples them socially, it cripples them financially, it cripples them at a very personal level, that they cannot have normal interactions with people around them. So this is something that we need to educate people about. And this is something we need to bring to the forefront and say, stop any kind of mental trauma, stop this mental abuse. We need to start, voicing our opinions. Now, there are many other ways in which mental trauma and harassment can happen, especially in the workplace. When a boss, a senior doctor might, in just trying to correct a junior doctor, might shout at them in front of other people in public. Public correction or publicly giving feedback to people is not correct. That again leads to mental harassment. Sabotaging somebody's work, saying, oh my God, this is not good. I expected much more from you. You don't even know this much. What did you do in 5 years of medical school? Have you not learned anything? I mean, these kind of statements are devastating. They can, break the confidence of a person really, really badly. Taking credit for somebody else's work. And this is very, very, very common in medical academia, even in otherwise in academia, it's very common. You do a presentation, you share a case study, you've done a complex procedure, and your boss or your supervisor takes complete credit for it. Or somebody else might take credit for it. All these are forms of emotional harassment, making rude statements, belittling your coworkers, putting them down, talking rudely to them, shouting at them in public. All these are classic forms of mental harassment, mental trauma, and mental abuse. Now let's look at another section of another type of harassment, which is on the rise. And this is religious harassment. Can somebody tell me what is religious harassment, and can you give me examples of religious harassment?
Polarization.
Very good. Polarization. Very nice. What else?
Bigotry.
Bigotry. Excellent. Thank you so much. Very, very good. Now, in fact, religious harassment, I would like to put it into two categories. One is where employees at the workplace are required to abandon certain religious beliefs that they have. For instance, we see this all around us. Suddenly, there is the ban on hijab. Now this for Muslims is something that they would like to wear. Muslim women, it's a practice in Islam that we cover our heads. But suddenly a country passes a law saying that you cannot no longer wear a hijab, the hijab ban. And this is freedom. They're taking away our religious freedom. They're not allowing us to practice what is inherent to what is mandatory to our religion. So that is a form of religious harassment where you are forced to abandon your religious beliefs, your religious clothing, your religious practices, just because you're working in a particular environment. That freedom is taken away from you. So that is one form. The other form is comments, bigotry, polarization, like all of you all said. They see you, for example, let's look at Muslims. Somebody sports a beard and is working in a very secular environment, say in California or in India or in any other part of the world. And many non-Muslims, thanks to the media, I blame this completely on the media, they see a person with a beard and immediately think we are all terrorists, or they get scared of us, or they don't trust us and they avoid us, and they make very subtle remarks or jokes around us, jokes around our religion. All these are forms of religious harassment, which cannot be tolerated anywhere across the globe. No matter where you work, we need to let people know that we cannot tolerate. I'm not asking you to fight with them. I'm not asking you to go out and have a morcha or a dharna. No, ours is a very, very, very peaceful religion. It's a very tolerant religion. educate people about your religion. Let them know that we are no threat to them. Let them know that we are very inviting. The way we conduct ourselves, we become ambassadors of our religion. So we have to educate people around us, non-Muslims, about the truth about our religion. And this is not happening only with Islam. Many other minorities, if you are a minority in a particular country, there is most likely chances that you will be attacked religiously. There will be some form of religious harassment, whether it is India or whether it is New Zealand or Australia or California or any other part of the world that you are in. Religious harassment is on the rise, and we have to stop it now. So these are things that we need to be very, very, very careful about. Now that you've understood the various types of harassment, can any of you all give me some ways in which you know what are the giveaway signs that a person is being harassed? We've already discussed it in the previous slide. So a quick few points from you all would be really, really beneficial. What are the signs or the giveaway signs that a person is being harassed?
Lack of concentration at work.
Okay, lack of concentration at work. All right. How do you know that you are being harassed? Sorry?
The productivity of that individual is reduced.
Very good. Productivity of the individual is reduced. What else? How do you know that you're being harassed? All right, let me show you all a few points out over here. These are very, very, very common ways in which a person is being harassed at work. When you ignore somebody, you have a brilliant idea. You go to your boss and you share that idea, and that person completely stonewalls you. You come up with lovely ideas, innovative ways of working, the latest research, and you're completely stonewalled. Your ideas are just thrown in the dustbin. That is what we call stonewalling. They completely give you the cold shoulder. That's a form of harassment. Verbal aggression, when somebody talks loudly to you in your face, crossing your personal space, putting you down, insulting you, correcting you in public. All these are forms of verbal aggression. Public humiliation.
Excuse me.
Yes.
I just need to understand exactly. When you said stonewalling and ignoring amounts to harassment, how exactly is ignoring one amount to harassment?
See, it's not just one incident that's being harassed. You keep coming and you showcase, say, your seniors, you present them with a lovely idea or a case study or a paper that you want to collaborate with them and write, and they ignore you every time. And you realize when the same idea comes from another person, it is being accepted. But when you present that idea, it is being ignored by you. They stonewall you, they ignore you. And it's not happened once or twice. It's happening again and again and again. That is a form of verbal harassment. It is a form of ignoring. When you ignore somebody consistently, it is a form of harassment. It's not, it might not of verbal harassment. You're ignoring
somebody.
them.
I don't think so. No. See, I just want to understand this. When you say ignoring someone,
yes,
why does it amount to verbal harassment?
Tell me, how do you feel when somebody ignores you, sir?
There's lack of communication in between each other, right?
No, that's lack of communication is different. In lack of communication, you will respond in some way. Ignoring is an intentional, behavior. Sorry, go ahead.
Yeah. In stonewalling, is there a communication in stonewalling?
You just ignore the person. You're showing a cold shoulder. You're not even acknowledging the presence of the person. You're not even giving the person the respect.
How is it amount to verbal harassment?
That is harassment. That is a form of harassment, isn't it? When somebody is ignoring you consistently, how do you feel? What happens to your confidence?
Dr. Noor?
Yes.
Yeah, I think there's a little miscommunication. What he means is when the people are not talking, you don't call it verbal harassment. You probably meant it's psychological harassment. Correct me if I'm wrong.
You're absolutely right, doctor. But even in verbal harassment, we have in communication, there are various parts of communication. You have verbal communication and non-verbal communication. So we can very nicely put this as non-verbal communication of harassing somebody in the non-verbal manner. Body language plays a huge role in harassment.
Okay.
I come and talk to you and you turn your back to me and you walk off. I come and give you an idea and you ignore me. I share something and you don't respond to me. What kind of communication is that? Isn't that a form of harassment? Isn't that a form of putting somebody down? Isn't that a form of belittling somebody? All this comes under communication, and it is a form of harassment. And in fact, in the definition of harassment itself, it says, all these are techniques in which are very common in across industries to harass another person, and leads to a form of a mental trauma. When somebody is constantly ignoring you, what's going to happen to your emotions? You're going to be mentally, you're going to feel very insecure. You're going to feel let down. You're going to feel angry. You're going to get into depression. You feel like, symptoms of hate and anger towards that person are built up. And all this is a form of harassment. So you cannot ignore. If you don't like somebody, very gently tell them that you agree to disagree with them and walk away from the situation. Stonewalling is not a healthy way of communicating with anybody. It's not an accepted form. Yeah, I hope I've clarified.
In that case, I think the harassment is an umbrella term.
It's a very broad concept. It's a very, very broad concept. And and you can actually file a lawsuit. A person who stonewalled can go to court and file a lawsuit of harassment against the person who's stonewalling them. In fact, there are several cases that have happened like that, and it comes under mental torture and abuse. Even in marriages, even within your families, when you stonewall somebody, when you ignore them, when you put them down without saying a single word, completely ignore them, that is a form of mental trauma and harassment. That's why when I said types of harassment, we spoke about various emotional and mental forms of harassment as well. So this is one form of torture. It's one way of torturing people. Even when parents get angry with children, sometimes they don't shout at them, they just don't talk to them. They just keep quiet. And no matter how much the child does to make up, they don't respond, at least for some time, maybe for half an hour, 1 hour, sometimes a day, depending on the severity of whatever the child has done, the mistake of the child. Yeah, which is fine. To teach somebody a lesson for a short duration is fine, but constantly doing that, it becomes a form of harassment. Yeah. So harassment, as you very rightly said, sir, is a very broad topic. Yeah. Again, as we said, verbal aggression, public humiliation, constantly challenging somebody's ideas. You present an idea and say, really, do you think that it's going to work? Are you sure? I'm not so. I don't think it's a feasible idea. Or rejecting them point blank and saying, what, we don't have the resources to do this. It's not possible. And doing this again and again. I can understand once in a way if it happens once, twice, thrice, but making it a habit and a common practice is one of the most common signs of harassment. And you're doing it only to that person. We can understand if you're doing it to multiple people out over there, where really the organization does not have the resources, the hospital does not have the resources to implement a particular idea or a technique or whatever it is. But if it is being executed just to one person or a particular group of people, that comes under harassment. Isolating people, excluding them from conversations, giving them the silent treatment, which is again very similar to stonewalling. All these are forms of harassment. Even gossiping, forming cliques within the hospital. You can have people from different regions who are forming cliques, small groups, and they gossip about other people. All the senior doctors sit at one table, and no junior doctor is supposed to sit out over there and have lunch with them, or and it becomes a separate gossiping session. If it's just segregation, which is fine, but if it is with a lot of gossip, where you're gossiping about other people, then that becomes a form of harassment, because you are discrediting the other people. And gossip has a way of spreading like wildfire, and it can go across the organization, across the hospital, and there might be very little truth in the gossip, and that can create a very bad reputation for the other people, for the other doctors, for the other nurses, for medical and paramedical staff who are being victimized. It's a form of victimization, which is very, very, which is not accepted at all. And even Islamically, gossip is not encouraged, it's completely condemned and looked down upon. Corruption and exploitation, we can club these two. This is very, very common in the medical fraternity, where they say, you give this, you do this favor for me, and I will do this for you. You want leave, you want to change your schedule, then okay, you have to do some favor for me, either come out with me for lunch or something else. They're very explicit in their expression. So corruption and exploitation is very, very, very rampant. And when you experience all these things happening around you, you know that you are being, you have to take steps to stop it. And we will talk about ways in which we can actually, stop this kind of harassment in the next few slides, inshallah. Terrorizing a person, creating fear. I know best. You are just a newcomer. You are just a new doctor. You don't have much experience. I have done so many cases. I am better than you. I have attended so many conferences. I have done all these difficult, intricate procedures. What have you done? Terrorizing the person, instilling fear in somebody else, showing off, throwing that power around. all these are techniques to terrorize people. And finally, we have gaslighting. What is gaslighting? Gaslighting is becoming very, very common, and it's one of the biggest forms of mental harassment. Anybody knows what gaslighting is?
You behave in such a way that you make the other person feel that the fault is theirs.
Very good. Absolutely. Absolutely right. It is a form of manipulation. You manipulate the abuser in such a way that they question their own reality. They question their own values. They begin to question their own belief systems, their own perceptions, and they lose confidence completely. And this is a very big form of mental trauma, mental abuse, mental harassment is because of gaslighting. And if you confront the abuser, they'll say, oh, I didn't see that. I was just joking. Come on, can't you take a joke? Can't you take things in the light spirit? Why are you becoming so serious? I'm sure we've all heard people saying this, oh, don't take things so seriously. I was just joking. I was just pulling your leg. But it was not a simple joke. It was a joke with a particular intention. Yes, please go ahead.
Dr. Noor, does this happen more at the workplace or in personal relationships?
In fact, it happens in both places. In the workplace, it's very, very common, and it's because we talk in the workplace, we talk about toleration and having an attitude of patience and tolerance. It's more common in the workplace, but nowadays, of late, with both men and women going out and work, it's becoming very common among spouses as well. It's becoming very common in joint families. So you see, I'm getting a lot of people who are coming with marital conflict where the major problem is gaslighting. But in the corporate sector, in the medical fraternity, it is rampant. And they'll just laugh at you and say, come on, don't be so silly. I was just joking about it. I mean, take it, just go along with it. So they make light of it. But in at the personal front, it's not very easy to make light of gaslighting. So it becomes more prevalent, and people who have marital conflicts are coming up and talking more about it. But in the corporate sector, people don't talk. In the medical fraternity, they don't talk too openly, and they say, you know what, this happens. They adopt a very placid attitude towards it and say, hota hai, chalta hai kind of an attitude. Are kya karne hoga iske bare mein? It's so common, but it is a form of harassment, and it's not acceptable. It's just not acceptable because it has a long-term mental impact on the person, and that's just not done. Yeah. So these are various ways, signs that a person is being harassed. Very true. Dr. Nikhat, Fatima says a lot of times people are unaware that they are being gaslighted. You're absolutely right. They don't even realize it. It's become so common that people don't even realize it. It's time we sensitize them to all these things. It's very, very, very important. And thank you for pointing that out, Dr. Nikhat. Really appreciate it. Now let's look at some of the causes of harassment. Why do you think people harass other people? What's in it for them? Why are they doing it? Any guesses?
Evil pleasure is one.
Sorry, I couldn't hear you.
Evil pleasure.
Not very clear, sir. Sorry. Can you just type it out on the box? In the chat box?
Yeah. Okay.
Sorry. Displaced insecurities. Very good. Excellent. What else?
Power play.
Power play. Fantastic. Yes. What else?
They're innately evil.
They're inherently evil. Yes, they might have a personality disorder. Absolutely right. What else? As you all very rightly says, to show authority, power play. That's the number one reason. I know better than you. I have been longer than you. I am more experienced than you. And most senior doctors have established themselves, their reputation in the industry. And when you have, say, a junior doctor who's brilliant, who comes in, they might be threatened by that. The power balance might go this side, that side. So immediately they realize they have to stand their ground. And the easiest way is through harassment, the various forms of harassment that we discussed earlier. Professional jealousy, so common. We've all experienced it. Somebody is jealous, they don't share information, they don't share case details, they hide information. All this could lead to professional jealousy. They're so scared that somebody, and jealousy is a form of insecurity. When a person is jealous of somebody else, it means he has deep-seated insecurity. He is very, very, very insecure. Sometimes in many cases, there are whistleblowers, the past experience. Some doctors might have experienced that somebody else has spoken negatively about them, or has, highlighted something wrong that another doctor did, and it has represented, and it's become a black mark on the entire community, that most senior doctors are like this. So they are very scared of whistleblowers, so they become very strict, they become very loud, they become very authoritative, in order to protect their own reputation. So they're very scared of whistleblowers. Hierarchy is very common. Yes, there's another, and we have to follow hierarchy. We have to give our seniors the respect, and that becomes a form of abuse, and it becomes a form of harassment. I mean, hierarchy today is okay to some extent, but overdoing it is not accepted. In fact, we want more of a flat culture where there's a lot of lateral movement rather than too much of hierarchy. Again, as somebody said, evil pleasure comes under deviant personalities. This is something, some people are just inherently very aggressive, very abusive, very loud, and it's part of their personalities. And that is something that could lead to harassment. So deviant personalities, and it might show that they actually have a clinical condition. People with mood disorders, people with borderline personality disorder, people who are very short-tempered and get angry very, very easily at the drop of the hat. I have seen doctors who have zero tolerance. Oh my God. Not just with their co-workers, but even with patients. I mean, very recently, I was in one of the prestigious hospitals in Bangalore, and a patient was waiting for a really long time to meet a very senior gastroenterologist. And this doctor barges in, and he just dismisses the patient and says, you know what, I can't see you now, reschedule, I don't have time. And the patient was so angry. And I said, how could you do this? You can't do that. You can't talk to me rudely in front of others. You can't tell me things like that. I've been waiting for the last 1.5 hours. I've taken an appointment. And the senior doctor was so arrogant. He was so arrogant, which is a form of personality disorder, which is not done. All these are forms of harassment. Stereotyping, very nice. Firdaus says stereotyping could also lead to harassment. Yes. And sometimes it's just personal reasons that could cause harassment. I don't like the way you look. I don't like the way you dress. I don't like your skin color. I don't like your religion. So I might find something that I dislike about you, as a result of which I start harassing you in various ways, by pointing fingers at you, by stonewalling you, by putting down your ideas, whatever it is, all the signs that we saw earlier, it could be because of personal reasons, because I have a personal vendetta against you. So there could be so many reasons why, so many causes for harassment. In fact, I'm going to go back a few decades and look at what happened in history. We look at it from the American point of view and the global standpoint, and we'll also look at it from the Indian standpoint. So I will talk to you what happened in India as well. But as early as 1977, it was Catherine, a feminist legal scholar, who said that sexual harassment is also a form of harassment in the workplace. And this was defined for the first time by the American courts, by their Supreme Court in 1977. And after that, a lot of incidents started to happen. In fact, in 1991, the Anita Hill case with Thomas Clarence, when it was publicly televised, and Anita Hill came open in public and told how she was sexually harassed by Thomas Clarence, that everyone got a shock of their lives to realize how rampant this was across industries. And when this happened, many women across organizations started voicing their opinion and started saying that we too have been sexually harassed. We have been verbally harassed. We are being mentally traumatized. And as a result of this, what happened is many companies immediately started putting certain laws, processes, and procedures within the organizations. They started conducting mandatory training programs, and they started telling their employees, if you have a problem, we have created a grievance cell. Reach out to the HR department. Tell us what your problem is. We are ready to support you. We are here to help you. We are here to take care of your needs. And they started becoming very verbal about it, and they started doing a lot of good work to protect the interest of women. It started with women harassment. Today, these grievance cells are open even for men across sectors, especially in the IT sector, because men are also being harassed today. So companies started doing this as early as 1991. In fact, 75% of American companies developed mandatory training programs immediately soon after the Anita Hill and Clarence Thomas case, and 95% immediately started having grievance cells, started creating grievance cells within the organization where people could come and report, if they have been harassed in whatever way. For a couple of decades, most organizations felt good about this, that, okay, we're doing such amazing work. We are helping people out over here. But they were dealing with a major problem. In fact, the problem exists to a much greater degree even today. In fact, in the Me Too hashtag, which came about in 2018, yes, it was in 2018, showed us that 40% of women and 16% of men are being harassed across organizations today. This is 2018. People are now talking about it. Earlier, I mean, it has not stopped. It's just that people were not talking about it earlier, and today they are raising their voices against it. Today, now it's coming to public light, public forum. Today, people are becoming more vocal about it. But still, lots needs to be done in this area. It's rampant everywhere, and it has not reduced, despite organizations doing their best to help people, to help their employees. Still, there are a lot of unsaid incidents that are happening. There are a lot of unaccounted incidents. There are a lot of cases that are going hidden and that people have not spoken about, that needs to come to the forefront. Let's look at the incidents in the healthcare industry and why it is so prominent in the healthcare industry. Many factors make an organization prone to sexual harassment. Hierarchy, as we spoke earlier, one of the most common factors is hierarchy, a very strict dominating environment, very hierarchical structure, a male-dominated environment, and a climate that tolerates transgression. And tragically, all these three components are prevalent, rampant in the healthcare industry. In the medical industry, these three things are, present, and it's a thriving platform for different forms of harassment. Studies have shown that 70% of female physicians and 50% of female medical students have reported to being sexually harassed. And this is as late as 2018. 2018, just a few years ago. 70% and 50%, can you believe it? It's still present in the medical industry. And this is shocking. These are shocking statistics. And it's very, very, very sad to see this. Let's look at some more statistics. Let's look at a study that was done with nurses. 35% of female nurses were verbally abused. And this was a study done in 2020, much later, not in 2018. This is in 2020. And this is published in medical journals. And these are proper studies that are being done. 32.6% were non-verbally harassed through body language, through stonewalling, through ignoring. 31% were physically harassed and 40% were psychologically traumatized. 46.59% of them were harassed by patients. Imagine patients harassing nurses who are helping them, taking care of them. They're harassed by patients. 41% of the nurses were harassed by physicians, by doctors. 27% by the patient's family. 20% by other nurses, and 17% by other co-workers that were present out over there. Shocking. Absolutely shocking. 44.6% of these women were harassed. These nurses developed mental problems. 30.19% had physical health problems, diabetes, thyroid, high blood pressure, various migraines, gastrointestinal disorders. 61.26% of them were emotionally disturbed because of this harassment. And 51.79% had reported psychological disturbances. 16% had social health problems and could never get back to proper family life. They started avoiding, if you read the entire case study, it's so amazing to, check out these papers and studies and read these published findings, because you see where the nurses are, people who are being abused have told that they're not able to have proper communication with others. Family functioning has broken down. They are scared of people. They're avoiding situations where they have to interact with people. This is the psychological trauma that's caused to people who are being harassed. And it is very, very, very sad. In fact, let's look at the cost of harassment. It's not like the hospitals don't know about it. Let's look at two case studies from the University of South Carolina, USC, a very big medical school, a very big medical hospital out over there. They had faced several allegations of sexual assault among the medical staff. That means between doctors, and even several patients complained to them of assault by doctors. In fact, in the study that was published, they very clearly say that a particular gynecologist abused and sexually assaulted one of the patients, because of which the hospital had to do a settlement of $215 million to its victims. Not a small amount. 215 million went in settlement for harassment cases. In another case, in the same institute in USC, despite knowing that $135,000 settlement was done with a woman who had reported to be being sexually abused by an ophthalmologist, Dr. Rohit Verma. And in fact, even with his name, it is mentioned in the medical journals in 2003. Despite the settlement, you know what the USC management did, the USC leadership did? They went on to make the same doctor, Rohit Verma, the dean of the medical school. I mean, what is wrong with us as a society? You know, this man has sexually exploited other people. You have paid in settlement $135,000, and then you're giving him a bigger post and making him the dean of medical school? How shocking is that? And when the public got to know about this, they started complaining, they started questioning, and they started asking all sorts of questions. As a result of which, Rohit Verma had to take resignation. And the entire management, the USC management, hid it, saying that we have now lost confidence in the leadership of Dr. Rohit Verma. They just hid the entire thing. But this is so common in the medical fraternity. Just go back, look at the studies of the amount of settlement, the settlement amounts that have been paid to doctors, that have been paid to patients. The numbers are staggering. They are shocking. They are mind-boggling. And this is a very, very scary place to be in, because if these are the people who are responsible for our health, we are placing our health in their hands. We come to them when we are sick, when we are in times of need, trusting our doctors, trusting our nurses. And if we are going to be abused by the very people out over there, it's a scary proposition. We will think twice, we will think 100 times before we enter another hospital. So it's really, really scary. In fact, 75% of the employees across industries, not just the medical fraternity, have personally experienced or witnessed some form of workplace misconduct. It is time, my sisters and brothers, it is time to listen to them. Sexual harassment and discrimination have a huge impact on an individual's physical and mental health, resulting in increased anxiety, depression, burnouts, PTSD, post-traumatic stress disorder, and a host of other personal and financial consequences. It also impacts the overall psychological well-being. It's scary. The place where we are in today is scary. We are saying that we are progressing as a society, but honestly, we are becoming more of a barbaric society. We are regressing, and something has to be done about it. Something has to be changed drastically. Let's look at what happened during COVID. Even more recently, let's look at real life examples from India. Let me share some statistics and facts with y'all as to what's happening. How many of y'all have heard of quid pro quo? Do you know what quid pro quo means? Sorry, unable to hear you. There's too much disturbances, sister. Could you please type out?
It is just a favor, which can be granted for something.
Very good. Absolutely right. It's a favor being granted for something. It means you give me this and I will give you something else in return. You know, the person has come to you in a time of need. Rather than just helping the person, you say, I'm not going to help you just like that. I need to get something out of this. I need some gain, either a physical gain, either a monetary gain, or a personal favor has to be done to me. So, and that became very rampant during COVID, 2019, 2020. So the maximum number of incidents based on favor. Let's look at some of the statistics. Absolutely scary. These are all case studies from India, not even global case studies. A man in Delhi explicitly asked for sexual intercourse in exchange for providing an oxygen cylinders to those in need. Imagine the state of low moral values. A 38-year-old female COVID patient was sexually harassed by an ambulance attendant while traveling to a scanning center. What can that patient do? You're already sick. You are incapacitated, and you have a person who's harassing you like this, who's abusing you. A female family member of a COVID patient was sexually harassed by snatching her dupatta and touching her waist while she was taking care of her husband. This is scary. In Islam, we used to say that all this used to happen during the Jahiliyyah time. It's happening again. We've gone back. We've gone back so badly. We've regressed as a society so badly. In fact, Islam came to prevent this kind of abuse. It came to give respect and dignity to people. Tragically, that's being taken away from us today. a 25-year-old female COVID patient's modesty was outraged for 2 consecutive days by her attending doctors. 2 doctors, 25-year-old COVID patient was abused by her doctors for 2 days continuously. It doesn't stop here. Look at this. Lots more cases out over there. A lady who shared her personal phone number online just to help COVID patients by giving them resources, beds, oxygens, was bombarded with inappropriate messages and solicitations of sexual intercourse. Scary. It's so scary. A male COVID-19 patient was sexually assaulted by a doctor while admitted in intensive care unit in a private hospital in Mumbai. You pay so much of money, go into the ICU. They're supposed to take care of you in the ICU, not sexually abuse you and harass you. And nobody is there. You don't have any family member to call out to. Who do you call out for help? At whose mercy are you? Are these the morals of our doctors, of our nurses, of our attendants? Scary. Several ASHA healthcare workers on COVID duty were being molested on duty by doctors, by their co-workers, and by patients and the patients' families. It's very, very, very sad. And the cases can go on and on and on and on. And this is really, really, really scary as to what's happening around us. And it just reflects on our society. Harassment is a reflection of low moral values of our society. It's time, my brothers and sisters, it's time to raise the bar. It's time to speak out. It's time to stop this kind of abuse. It's not accepted at all at any level. So let's look at some strategies, ways, tips, and techniques in order to deal with this kind of harassment. What can we do? Now, there's something called the bystander effect. Does anybody know what the bystander effect is? Any guesses?
You let things happen without reacting to what's happening around you.
Yes, absolutely right. When something happens, some calamity, some tragedy, a lot of people, there's an accident on the road. What do? We all rush to go and see what has happened. But how many people actually help out
I
that
think
patient?
these days they're more interested in recording what's happening and posting it on social media.
Yes, sir. Yes, you're absolutely right. They're more interested in putting it on Instagram, on WhatsApp, on Facebook, rather than helping the person in need out over there. This is even more disgusting. I mean, if you can't, help them, at least don't do something that's going to harm the person even more. The person is already in distress out over there. And that's the bystander effect. Now, there's an intervention model that was created, which is very, very nice. It was developed by by this lady called Sharon Potter. She created an entire intervention program. It was based on moral policing. And I think moral policing is the need of the hour. So what happened is whenever there was an accident, whenever there was an incident that happened, she trained a group of students and she worked very closely with the army. She took a group of armed forces, and anytime they saw something happening, whether there was a sexual joke that was made, these people would go and interrupt. They would call the cat callers out and say, you know what, this is not accepted. Don't do it. Anytime there was a fight, they would break up the fight. Anytime there were people who were making jokes, sexual jokes, or religious jokes, they would go and intervene and they would stop it. And they found that this intervention that they did was phenomenally successful, because the students that they trained and the people that they trained, they went on to become the moral policemen of society. And I think that's what we all need to do. When we see somebody making a joke that is inappropriate, we need to tell them that's not happening. When somebody starts gossiping, we say it's not done. We ignore that person. Anybody who's, and the best way to stop gossiping is by not being a part of it. When somebody starts talking about somebody else, get up and walk off from this. I'm sorry, I don't like to be a part of this kind of conversation. When you hear jokes of racial discrimination, sexually inappropriate jokes, or when you see somebody who's walking into the personal space of another person, just accidentally brushing another person, bumping into them, call them out and say, not done, voice out. And this has got tremendous response. We all have to become moral policemen for people around us. When the victim in many cases...
Something? Yes, I'm so sorry to interrupt you. Can I ask you something?
Yes,
in the slide, you say moral policing is the need of the hour, but isn't it very controversial and very debatable? I mean, vigilantism, it acts to enforce a code of morality in the society without any legal authority. I mean, it's very controversial. Right. I mean,
it is it's a very sensitive topic. In fact, very debatable topic, but this is just my personal opinion, because when you see that nobody is talking around, talking or voicing their opinions. We need some people at least to start talking about it. We're not enforcing and saying, do this, don't do that, but at least call out when you stand up for something wrong, stand up when you see somebody being, call out a
I think
person
it
who's,
really helps.
as a person.
I think,
It really
according
helps.
to me, it really helps when we say no, and someone is troubling another person and
Saying
we
no does not
interfere.
amount to moral policing. I'm so sorry to say
It
this, but then
isn't.
saying no
It is
and then
moral
objecting something
policing,
towards
and I think
happening
we
is
should do
nothing to do
it.
with moral policing.
And I
No,
think
it
we
is a
should do
form.
it.
It is a form
When
of
we
moral
have this
policing, sir.
power, I
It
think
is
we
a
should
form
do
of
it.
moral. Yeah.
When
In
we
fact,
see
we
a
have.
person being troubled, I think we should stand up. Whether it's at
Correct.
home or whether it's in the office, I think we should stand up because people don't like to be called out. Okay, sorry, Dr.
But
Noor.
standing up to somebody being oppressed is not considered or not fall under the purview of moral policing. Moral policing is vigilantism. In plain words, it is called as vigilantism, which
Yes,
is
sir.
to act or enforce your code of morality, which is very relative to individuals. Okay,
Yes, sir. You're
the code
absolutely right. It's
not
just that the
same
definition is being changed,
ethnically,
sir.
demographically is not same. Correct?
Yeah,
And then
sir,
it has no legal authority to be enforced upon. So
yeah, they can.
vigilantism.
Yeah,
Yeah,
I got
see,
your point, sir.
when
I understood what you're saying. I got your point. Let
yeah.
me address the
Okay.
concern. See, the definition of moral policing today is changing. And what you said is absolutely right. I do not disagree with you at all, even one bit. But when you stand up to an oppressor is also a subtle form of moral policing, which is the need of the hour. This is a very recent change in the definition of moral policing that has happened. And I'm only sharing this with you because we have been part of these platforms where we are discussing what is moral policing, how can we do it. And today there are small case studies, there are small journals that have been published on moral policing where we're changing the definition. But what you said is absolutely right. By definition, that is vigilantism is technically what moral policing is. Yeah, by definition. It's just right now that we are expanding the definition of moral policing and we're extending it even to this. In a very low, simple way, we in the simplistic form of moral policing is stand up and voice your opinion when you see some kind of abuse or harassment that's happening. In a very drastic way, it is vigilantism, as you very rightly pointed out. And at that point, it goes into extremism, which is not accepted. That leads to other challenges and problems as well, which I completely agree with you. In fact, it would be really, really, really nice if we can have a separate session exclusively on understanding what moral policing is. That would really help a lot of people. But thank you so much for pointing this out, because this is a doubt that many people had, and I wanted somebody to ask this question. So thank you, sir, and thank you so much, Nausheen, for sharing your thoughts as well. It's time for us to stand up for what is right, and it's not happening. It's not happening enough. I hope I've clarified. All right, let's move on. Now let's look at ways in which we can combat harassment. Let me ask you a very simple question. What can be done by you to stop this form of harassment? Sexual harassment, verbal harassment, mental harassment, religious harassment. What can you do? What can each of us do as an individual? Any thoughts?
First thing, I think we need to be aware of what exactly constitutes to harassment.
Okay, very good. Yes, yes, brilliant. So we need to attend awareness programs. We need to attend sessions where we know what is harassment. Very good. What else? If I'm being harassed, what can I do about it?
Sometimes all it takes is a simple no.
Yes, very good. Thank you so much. All it takes is a simple no. Draw your boundaries and just voice your concern. Just say no. Excellent. What else?
Talk to people about it who have the authority to deal with it.
Yes, very nice. Even Nikhat said the same thing. Talk to people about it. Reach out to people you know who can help you out. Very, very good. Excellent. What else? Stand up for yourselves, as Dr. Almas. Absolutely right. Bang on. You'll have got it out over there. First and foremost, do not let fear of threat overwhelm you. It's natural to get scared, but don't let it overwhelm you. Don't let it overwhelm you into being silent. So please muster the courage. Typically what we do in most situations is when we are being harassed or any form, something that happens, it's something that threatens us, we fly away from the situation, or we fight. The flight and the fight response. Yeah, we do these two things, but we have to find a common way where we neither fly away nor fight. There is a way in which we can handle this. So first, combat your fear, deal with your fear. Take the help of people who are neutral and who do not take sides, who can pass a neutral judgment. It could be your friends, it could be your colleagues, it could be co-workers, it could be people in the organization, in the management. Talk to people who are not biased. Inform the next supervisor in authority. Let people know about it. Immediately go and report it. Maintain your high level of quality and performance at work. Now, this is something that has come out again and again and again in several studies. If you excel in your work and if you hold your ground, most people will stay clear of you. Put your best foot forward. Whatever you do, be good in your job, and you will find that fewer people mess around with you. Contact a grievance cell. Every organization that has more than 10 people has to have a grievance cell as per the government law, as per the law. You have to have a grievance cell, every organization, every hospital. So contact your grievance cell immediately. Create a support group within the organization as well as outside. So you can have a women's protection group, you can have gender equality groups, discrimination prevention organizations are there to help you, community centers are there. Reach out to them for help. Seek professional help from psychologists, therapists, and counselors. We are here to help you. Coming to a psychologist does not have any stigma. In fact, if you don't seek professional help immediately, it can have a rippling effect. It can have a drastic effect in your personal life, in your professional life. It can cause a lot of other dysfunctions within your life. And most importantly, seek legal help. I will share phone numbers. I will share places where you can go immediately for help. All these details I will share with you, inshallah, in the next few slides. Most importantly, protect your mental health by establishing boundaries. Let people know that they cannot cross your personal space. Stand up and say no. Be vocal about it. So people know they cannot mess around with you. If you keep quiet and you don't stand up and you don't voice, then other people will take you for granted. Oh, she didn't say anything when I did this last time to her, so maybe I can push it one level forward. So establish your boundaries. Be very, very, very clear. Do not feel bad if somebody has abused you. Don't put the blame on yourself and say and go into a victim mentality that's saying that this is my destiny, this has happened to me. Don't go into depression. Don't get caught into the learned cycle of helplessness. We call this in psychology as the learned cycle of helplessness, where you start blaming yourself and it becomes very difficult when you get caught in that loop. So please avoid self-blame. Somebody is wrong, call them out for it, hold them accountable for it. The next point is very important. Avoid engaging. What do I mean by this? Any guesses? Avoid engaging. Engaging in what?
It's basically to avoid enabling the others.
Yes, can you give me an example, sir?
Yeah.
Can you give me an example?
I mean, it's a form of encouragement. If you don't voice out your opinion, just like you said in the previously a couple of minutes back, if there's somebody is advancing towards you, and then if I don't speak it out, or if I don't establish my boundaries, they continue to do it a step forward. This is a form of enabling them or allowing them to take me for granted.
Correct. Also, sometimes what happens is we, just to make friends with people, our co-workers, we crack jokes. And we might crack an inappropriate joke without realizing it. Somebody else must have interpreted it in a different way. There's another form of encouraging the other person. Oh, she's a chilled out person. She's okay with these kind of jokes. Avoid engaging in sexually inappropriate conversation. Avoid engaging in discussing topics that are forbidden in the workplace. Avoid any form of encouragement, as our doctor really, as our friend really said out over here, in any way that would encourage the other person to take advantage of you. So that is engaging. In extreme cases, when you're not getting any support from people around you, from the hospital, from the organization that you're working in, be sensible. Find an exit. When you know you cannot and the situation has not helped and you've already tried out extreme measures, quit the place. My sincere request is don't put up with the trauma. Don't put up with the harassment. It's not worth it. Quit the organization, get a better place, talk to people, talk to lawyers, talk to your counselors, ask what help you can get. If you can slap a lawsuit on that person, please go ahead and do it. But do not continue to stay in a place where you're being abused, especially if the hospital, if the organization is not coming to your aid, if these people are not supporting you, if they are not standing by your side when they know somebody else is wrong, and they are standing for the senior doctor or somebody else who's the perpetrator, then leave, quit the place. That's not a healthy working environment. And most importantly, please show gratitude for what you have. That's very, very, very important. Yeah. In fact, there are a lot of studies have shown that people who are religiously inclined are better able to deal with challenges and have a greater satisfaction index than those who are not. So all I can tell you people is please strengthen your ties with your creator. That's very, very important. Yeah. From the Islamic perspective, I'm just going to share a few points. I'm sure many of you all are already doing this, but for those who are not, please try and practice these few things. This really is a source of strength. Connecting with your creator is a source of strength. I encourage most of you, all of you all, every Muslim who's here, to please read the morning and the evening supplications, your morning and the evening adhkar. They form a shield around you, a form of protection. Allah subhanahu wa ta'ala sends angels to protect us when we call upon him for health. There's a fantastic app which you can download called the Wayyaka Nasta'een from Al Huda. You can download it on your phone. It's free. It has all the morning duas, the evening duas, the duas for protection, very powerful supplications out over there. That's one thing that I would encourage you to do. Seek forgiveness for our sins. For whatever we do, be in a constant state of astaghfar. And Allah loves the one who comes and repents, who seeks forgiveness. And these are the most beautiful days of Dhul Hijjah. So I encourage you to repent for what we do, because Allah not just forgives our sins, he ensures that he protects us for the rest of our lives as well. Also, I would encourage everyone over here, if it is possible, to get up 10 minutes prior to Fajr, and just read 2 rakat salah out over there. Get your tahajjud, because tahajjud is such a beautiful time where Allah has promised, he has guaranteed that he will answer the duas of every person who calls out to him at the time of tahajjud. Allah comes to the lowest heaven during tahajjud. So 10 minutes before Fajr, get up, go down in your sujood and cry your heart out to your Rabb. Whatever problems you have, when you are in sujood, when you are in sajda, ask your creator to help you. There are certain situations that are beyond our control, that are out of our control. And that's where we need Allah's protection. We need his guidance. We need his support at every step. So I would encourage you to try and get up for tahajjud. Start off with once a week, and then maybe gradually you can increase it to twice a week. But try and do that, because Allah has guaranteed that he will answer the prayer of a person who gets up in tahajjud and calls out for him. Very, very, very important out over here. And another very powerful way of strengthening your connect with your creator is giving charity. Give sadaqah. Sadaqah wards away evils. Sadaqah can be a smile. Sadaqah can be helping somebody. Sadaqah can be as simple as giving 5 rupees to somebody. In fact, what I do in most of my training programs when we are doing Islamic sessions is I encourage our Muslim brothers and sisters to create a small sadaqah box at home. Keep a small box at home, and every day you can put 2 rupees, 5 rupees. At the end of the month, collect all that money and give it off to somebody who's needy, who's very deserving. And that is a very powerful form of protection against any calamity. And in fact, sadaqah and charity is recommended in all religions. You see it in Christianity, they talk about charity all the time. In fact, we have a lot to learn about from the priests and from the sisters, the missionaries who go out over there, and there is so much of charity work. So every religion encourages charity, and so does ours. Islam encourages charity in many, many, many ways. And this I can give you in writing. The stronger your bond with your creator, the lesser the troubles in your life. And even if there's a calamity, it'll be so easy, it'll go off immediately. It's very gently, it'll go off. The effect of that is not very long lasting. And if you look at the last 2 ayats of Surah Baqarah, what does Allah subhanahu wa ta'ala in the last 2 ayats of Surah Al-Baqarah? Amana Rasuluhu. He said, I will not burden a person more than they can handle. So if you are put in a difficult situation, it means Allah has given you the strength to deal with that situation. You have the strength to come out of that situation. So please don't lose confidence in yourself. Muslims ideally should not get depressed, because our tawakkul in our creator should be so strong that whatever happens, there is goodness in it, and we have the strength to overcome it. We have to just stand up and take the next step forward. So this is from the Islamic point of view. We've been talking about secular ways of dealing with harassment and problems, but from an Islamic perspective, these are things that we can also do and we should do. These are certain conversations to avoid at the workplace. Avoid conversations regarding personal appearance of people. Not done. No matter how drop dead gorgeous that person is looking, please avoid that. Be professional at work. Just give a compliment saying, Alhamdulillah, you're looking really nice. So, that dress looks really good on you. Keep it simple, whatever it is, crisp to the point. Don't overindulge in people's appearances. Avoid topics related to religion and politics. Workplace gossip is a strict no, no, no. Avoid inappropriate jokes and non-work related topics. If we can do this, we put our best foot forward. We become very professional. Another way of showing how professional you are is to be punctual. And I have seen that punctuality is the worst among doctors. Worst. I mean, they make you wait for so long, and you'll be waiting patients. There's a long queue of patients, and half an hour after the doctor walks in. And it's not done. It's not done, whatever it is. I understand you're coming from one hospital to another hospital, or you might have your own clinic, but try to be on time. Punctuality is something that's highly encouraged in Islam as well. When you give your word, you need to honor your word. I know you don't have to be, it's very difficult to be on the dot every time, but as far as possible, please try to do that, because that's the professional front. We are ambassadors of being Muslims. We are ambassadors of Islam. So the way we conduct ourselves in public is how people recognize us and how people treat us. If people are treating us badly, is because we have not corrected them, or we have not put our best foot forward. So these are small things that we can do to avoid harassment at the workplace or wherever we are. Now let's look at things that organizations can do, and they are doing it. It's not organizations are not doing it. They're implementing all these things, but I'm just highlighting this so that the rest of the people also know that organizations are making a lot of effect, are doing a lot of things to prevent harassment at the workplace. First and foremost, they're doing a lot of training programs. They're orienting people on various forms of harassment. They're creating awareness programs, and their company policies reflect these awareness programs. They have companies have set up anti-harassment cells, and they are vocal about it. Everywhere. If you walk into every large company, you will see phone numbers, helplines that are put up where they say, please call us in case of help, for their own employees. These are all being done for their employees. They set up psychological well-being centers, and they encourage employees to seek professional help. In fact, every hospital, every organization, IT, ITS, hospitality, retail, any of them has to have a psychologist on board. It's mandatory that they should have a psychologist on board so that employees can go and talk about their problems to the organization. In fact, large companies don't even charge their employees for it. It is a service done by the organization for their employees. In hospitals also, it should be done. And there are quite a few hospitals that have employed psychologists, counselors, therapists exclusively for their employees, apart from being a separate, department where they can see outpatients. Even for their own employees, this privilege is being provided. Organizations today have regular performance reviews, and they ask for feedback. Their policies are constantly being updated, and they're encouraging people to give feedback, employees to give feedback. In fact, we do a separate session completely for employees as to how to give feedback. So if I'm a junior doctor and I'm giving feedback to a very senior doctor, I can't be very blunt. I can't just go out there and hurt his ego. It's going to create a lot of problems for me. So there is a way in which you give feedback diplomatically. We call this constructive feedback. In a constructive way, we give feedback, and it's accepted also. So we teach people how to give feedback and how to receive feedback. This is truly an art, and many people do not know how to give feedback. They're either too blunt, they're too rude, or they soft cushion the entire thing, and the entire essence of it is diluted. So learning how to give feedback is very, very, very important. I would encourage you to encourage people around you to attend sessions, to attend workshops where they learn the art of giving feedback, and you will find that this is very valuable even at the personal front, because we are constantly giving feedback to our children, to our spouses, to our in-laws, either giving or receiving, and we should know how to do it. And most problems in families happen because people do not know how to talk to each other. They are rude. We take our families for granted. We shout at our family members. In the office, in the hospitals, we're the best of people. You might be a mouse in the hospital, but when you come home, you're a tiger or a tigress in the house. You can make life for your family members really, really, really difficult. And that's not done. Yeah. So please learn the art of being sensitive and learn the art of giving constructive criticism or constructive feedback. Very, very important. I want to share what happened in India way back in 1992, because I'm talking about organizations now, and what made organizations start creating sexual harassment laws and stuff is the Bhanwari Devi case. Anybody knows what happened in this case? Have you heard about it, read about it? It was huge in 1992. Yes, no, not heard about it?
I haven't.
Okay, I'll tell you what happened. This lady, Bhanwari Devi, was employed by the Rural Development Program by the government of Rajasthan. And she was talking vehemently against child marriages. And she said, and the government had just launched a program saying that there should be no child marriages. And she was promoting that cause, and she was saying there should be no child marriages. And a lot of people got very, very angry with her because she was so vocal about it. And one day, a group of people went, they brutally beat up her husband and they brutally gang raped her. And what was even worse, what happened was even worse. What followed it was even worse. She took it was, the court dismissed her entire plea. The accusers went scot-free because of the kind of power they had, the kind of money they had, the kind of political influence they had. And this was very, very, very tragic. It's a black mark in Indian history. Because of this incident, many women activists were so disappointed. Lawyers were so angry that they filed a petition in the Supreme Court of India, and collectively under a platform called the Vaishakha platform. And in 1997, the Supreme Court, accepted their petition. And for the first time, they accepted sexual assault as a form of harassment. And they said that this is not happening out over there. And the first laws were laid down, and this was called the Vishakha guidelines. And after that, all this, the intention of the Supreme Court was to provide a platform for redressal and grievous mechanism. And this became the basis on which the entire POSH Act was established or created. In fact, I'm very quickly going to talk about the POSH Act. Bear with me for another 10 minutes and we will wrap up this entire session. I won't take more of your time because we need to know this. This is a government mandate. Every organization that has more than 10 employees has to have the POSH Act in place. Very, very, very important. And the POSH Act very clearly states it is for the protection of women and women alone against sexual harassment at the workplace. It to safeguard their interests. And the person who can file the complaint has to be a woman. It's not gender neutral. It's very, very specific to women. This is a very specific thing. As per the Act itself, if you can see by their definition, how they define sexual harassment, it is physical contact and advances, demand or request for sexual favors, making sexually colored remarks, showing pornography, or any other unwelcome physical, verbal, or non-verbal conduct of a sexual nature comes under sexual harassment as defined by the POSH Act. And this is something that's very, very important for all of us, that we need to know the importance of that. Under the POSH Act, every organization has to form what's called an internal committee, and there have to be 4 members in that committee. And the president should be a woman. And that's very, very important. And it should be a senior person from the workplace. So in your hospital, you need to have an internal committee to implement the POSH Act, and the president has to be a woman and a senior member of the hospital. There have to be 2 internal members who should be employees who can stand up for women's causes, who stand up for women's rights, and who've done social work and have legal understanding. And there'll be 1 external member who's tied up with an NGO who can help women in distress. So this is very, very important. So according to the POSH Act, at least 50% of the representation of the internal committee has to be women. So just for our knowledge, just to know that these are the rules that the government has also set in place to reduce sexual harassment at the workplace. They've also gone on to do something very nice. They've created something called the She Box. So this is done by the government of India, the Ministry of Women and Child Development, the Sexual Harassment Electronic Box. This provides women a window to go out there and lodge a complaint. You can be from any part of India and from the organized or the unorganized sector, public, private, government sector. If a woman is being sexually exploited, sexually harassed, sexually abused, all she has to do is log on to their website, register a complaint, and immediately the information is passed on to the concerned authorities and action will be taken. So the She Box is something that we need to make women aware about. This is there for women. We need to use it. We need to teach them how to use it. And this is something that's really, really, really important. Now, apart from all this, if you are not able to get help from your organization, from your hospitals, from the places that you work in, you're not getting any support from them, then these are places that you need to go to for help. There is help that's available outside your organization as well. And I'm going to share some information about it. I would request people to please take a screenshot of the next 2 slides that I'm going to share so that you can keep this information for yourself and use it in times of need. One organization which is doing amazing work in terms of psychological counseling, therapy for any form of mental disorder, for any form of abuse, harassment is Brainwave. Please take a snapshot of the slide. It's a very good organization. We provide complete online services. We have complete services online. So people from Dubai, from UAE, from various parts of the world, from New Zealand, from Canada, from Dharwad, Hubli, Bangalore can reach out to us, and we have the best psychologists on board. We look at cases of trauma, abuse, harassment, relationship management, any kind of mental health problem, bipolar disorder, schizophrenia, marital conflict, problems with children and child welfare. If you have a child who needs special education, who has special education needs, this is your one-stop shop. Anything to do with personal effectiveness, life skills management, career counseling, career transitioning, we are here to help you. Please reach out to us and we will find a way in which we can help you. The next slide is also very, 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 very important. Please take a screenshot of it, because in case you are being abused, you need to be rescued, you need a shelter, you need legal assistance. These are places who can help you. You have places like Vimochana. You have a lot of women's cells out over here. Please take a screenshot of this. Their phone numbers are there. Their helplines are there. Please share it with everybody that you know. Put it up in your workplaces. Maybe you don't need it, but you know somebody else who's being abused might need it. So please share this information with them. Finally, all I can say is it's time for each of us to find a cause to stand up for. My dear friends, please stand for something or you will fall for anything. It's time to raise our voice when we see oppression around us. One last thing that I would like to share with all of you all before we wrap up today's session is, I'm sure there are a lot of dentists out over here who are looking for a career transition, who are looking at ways in which they can stay at home and earn a good livelihood. We are here to help you make that transition. If you need career counseling, we are here for you. There are fantastic opportunities, and this could be for multiple reasons. Maybe you are not very passionate about your career, you are forced into dentistry. Maybe you have small children that's preventing you from going out and working. Maybe you have a family that's not very encouraging of you to go out and work. It doesn't matter what the reason is. We will help you figure it out. We will understand what your areas of interest are, and we will help you out over there. You could make a fantastic living working from home. You can become a life skills coach. You can get into learning and development and become a learning and development professional. You can get into research and content development. You can become a healthcare manager. The list is endless. Just reach out to the right people, and we are here to help you, to help figure things out. With that, we've come to the end of today's session. I hope you all found it useful. I now open up the floor for any questions. I'm sorry this took more time than expected, but I hope it was beneficial for everyone. That's it from my side.
Thank you so much, Dr. Noor. It was a really enlightening experience. We've got to know so much. Can I take up some queries? Anybody wants to ask any questions?
Dr. Shaista, you're on mute. Yeah.
Oh,
you need to unmute yourself. You're still on mute. Yes.
okay. Thank you, Dr. Noor. Thank you so much. This was a very enlightening experience. And I would like the participants to ask questions. Can you switch on your webcams, please? Can you hear me?
Yes, Dr. Shaista, loud and clear.
Okay. Any questions?
I don't have a question, but I would like to thank Dr. Noor for this wonderful session. See, some of the things we already knew, but hearing it again really helped. So thank you so much, Dr. Shaista and Dr. Noor, for putting this together.
Thank you, Nausheen.
Thank you, Nausheen, and thank you, Dr. Gausia. You've been the
thank you, Dr.
mind
Gausia.
behind this.
Yeah.
Okay, so there are no more queries. I think we can wrap up today's session. Dr. Gausia and Dr. Shaista, over to you.
Yeah. Thank you so much, Dr. Noor.
I don't have a question, but thank you to the entire team. Thank you, Noor and Dr. Shaista and everybody for organizing this, much needed topic. It's just that something that I'd like to share. While it's not necessary for everybody to share their experiences, but I think seeking help is absolutely important. Being a survivor of workplace harassment, I would say that it leaves long lasting impact. And when we spoke about PTSD, I can personally validate the fact that even till today somebody closes the door behind me, despite me working with professionals on this, it still creates anxiety inside me. So I think that aspect is very important, and the other is to educate our youngsters on what is consent and what is not, and of course to be aware of your rights.
First thing is being fearless, like Dr. Noor stated. Anybody else?
Thank you, Dr. Nikhat. That's very brave of you to come and share that experience. Thank you so much. Appreciate it. I think, Dr. Shaista, we can end up today's session and we can wrap up this meeting.
Okay, fine. Thank you so much, everybody. This was my first time, so thanks for bearing with me. Thank you, Dr. Noor. Thank you, Dr. Gausia.
Have a lovely day, everyone.
Shaista ma'am, can you hear me?
Yeah, I can.
I'm Dr. Nida. I just wanted to tell you that, certain terminologies I got very familiar with today, and some things which I could never express, which I could never display it in words, like what are those emotions, what are those feelings, what I'm going through. I think I have understood it much better. Alhamdulillah, I haven't experienced any sort of harassment in workplace, but these emotions are important to be understood by oneself, to to tell that there is a problem. And I think it was very, very enlightening. Whatever you spoke about gaslighting, whatever about stonewalling, we don't know how to tell it to others, like what you're going through and what the offender has done to us. So this thing was really, really important for me to know. They've done a wonderful job to me, at least. So thank you so much.
Alhamdulillah. Alhamdulillah. Thank you, Nida.
Incidences also creates a kind of shame or guilt amongst oneself. It's not easy to share or come out and open. Even to the closest peers and the family members, we refrain from sharing these kind of things, because we might. I have seen a lot of people getting insecure with the loss of job. People might, the family members might not encourage going to the particular job, and so people refrain from even sharing it to the family members or even to the closest peers. The fear is definitely there of self insecurity. So you're going through it, you're tolerating the things which you're not supposed to tolerate. So that is one thing I think that talk.
Yes.
So I think the gray area, the
Yes,
hesitation,
yes.
we can still sense, even in the attendees today, we can sense a lot of hesitation still to come out and open and speak about it and share, whatever fears or hesitations they have. So I think we still have a long way to go for this.
Yes, ma'am.
And I also think it's something to be dealt with very sensitively. Again, like Dr. Garcia said, the immediate blame is shifted to the one who's abused rather than the perpetrator. So we have to be
Exactly.
very mindful of that too.
Yeah.
Yes, you're right.
Anybody else? I guess there are no more queries, or so shall we call it a day now?
Yes, ma'am.
Dr. Gausia?
Yes, ma'am. Yes, ma'am.
Okay. Thank you, Dr. Noor.
Thank you so much, Dr. Shaista. Thank you so much, Dr. Gausia, for inviting me on board. This is an area that I was very, very passionate about, and I wanted to talk about it. So thank you for the platform.
Thank you, Dr. Gausia.
Thank you.
I think we can all leave the meeting, right?
Yeah, yeah.